On Darkinjung Country, Eleanor Duncan Aboriginal Services walks alongside families across the central coast of New South Wales, grounded in culture, governed by community, and committed to delivering better outcomes for Aboriginal people across the whole of life. Today, we invite government, philanthropic and system partners to see how a transdisciplinary, culturally responsive, community-controlled model of care is not only improving lives but changing systems. Eleanor Duncan Aboriginal Services is a community-controlled organisation delivering integrated health, social and community services across the Central Coast. While we are the only Aboriginal medical service on the Central Coast, our role extends far beyond primary healthcare. EDAS is a system builder and regional leader, designing, delivering and scaling culturally responsive services that respond to the real needs of community. Over time, EDAS has led multiple regional firsts, including the first Aboriginal core and cluster, the first and only Aboriginal out-of-home care service, the first Aboriginal Child and Family Centre, and the only day rehabilitation program for parents and caregivers. We also deliver connected beginnings alongside a broad range of early years, family, youth, disability, aged care, social and emotional wellbeing, housing, justice and community support services. Today, EDAS delivers more than 52 integrated services across multiple locations on the Central Coast, bringing health, social, cultural and community supports together into one connected pathway. So Aboriginal people experience care as a joined-up journey, not fragmented systems. Our work is grounded in culture, connection to country, kinship, language, identity, and a whole-of-life view of health that places social and emotional well-being at the centre. Community control is not just governance. It is how decisions are made, how services are designed, and how accountability flows back into community. EDAS delivers culturally responsive care, meaning our services adapt to the lived realities, strengths and aspirations of Aboriginal people, rather than expecting people to adapt to systems that were never designed for them. This same principle underpins our data our way, where EDAS exercises control across the entire data lifecycle, ensuring evidence reflects lived experience, protects community interest and strengthens self-determination. EDAS operates as a transdisciplinary organisation, bringing Aboriginal health practitioners, GPs, nurses, allied health professionals, Aboriginal caseworkers, youth workers, care coordinators and cultural mentors together in shared teams. This model reduces fragmented care, builds trust and shortens the distance between need and solution. Instead of multiple referrals and repeated assessments, people exercise warm handovers, shared care planning, and coordinated responses that address clinical, social, cultural, and emotional needs together. For families, this means fewer barriers, stronger relationships, and care that works around their lives, not the other way around. National data tells part of the story, but impact is best seen locally, where culturally responsive, integrated care changes everyday experiences for families. At EDAS, our internal data and service monitoring consistently show reduced reliance on emergency departments, driven by continuity of primary care and early intervention, improved timelines and completion of chronic disease care, supported by coordinated, team-based approaches, stronger antenatal engagement with earlier access to care and improved continuity for mothers and babies. These outcomes are not driven by single programs, but by a connected model of care that responds to the whole person and the whole family. Oral health is a gateway to overall wellbeing. Through the Googleura dental partnership between EDAS and Central Coast Local Health District, dental services are delivered on Darkinjung Country with a community-controlled setting. This partnership model improves access, reduces missed appointments, and ensures families receive care in environments that are trusted, familiar, and culturally responsive, strengthening pathways from prevention through to treatment. In disability support, EDAS focuses on access, quality, and safeguarding. Our culturally responsive coordination model has resulted in stronger plan utilisation over time, clearer alignment between funded supports and lived need, and reduced incidences across community-based programs, supported by strong governance and workforce capability. In aged care, where Aboriginal eligibility begins earlier due to higher and more complex needs, EDAS supports elders to age with dignity, connection and cultural safety. Our services show increasing access to culturally tailored aged care and elders care supports, particularly for those who have previously disengaged from mainstream systems. Early years investment is one of the strongest drivers of lifelong outcomes. But too often, the depth of preventative work led by Aboriginal community-controlled organisations goes unrecognised, measured through a government deficit lens that focuses on crisis rather than strength. At EDAS, prevention is central to everything we do. Through family preservation, out-of-home care, early years and wraparound family supports, we work alongside families long before systems would otherwise intervene. Our focus is on strengthening families, keeping children connected to culture, kin and country, and addressing the social and emotional wellbeing factors that underpin safety and stability. By 2027, EDAS will be delivering the new Aboriginal Child and Family Centre on the Central Coast, bringing early learning, health, allied health and family supports together in one culturally strong community-led hub. This centre ensures children are surrounded by language, identity and connection from the very beginning, while families receive the support they need early, reducing the likelihood of statutory intervention and building strong foundations for long-term well-being. This is prevention in practice, not because families are failing, but because systems must do better at recognising and investing in Aboriginal-led solutions that work. Our data, our way is how EDAS defines and measures what success looks like from a community perspective. We track cultural responsiveness, access equity, continuity of care, early years outcomes and system integration, alongside program performance, so our work is transparent, accountable and grounded in Aboriginal community governments and data sovereignty. At the same time, EDAS is continually elevating Aboriginal people as leaders, clinicians, caseworkers, cultural practitioners and decision makers. Investing in workforce capability and growing community-controlled expertise, often in the context of significant funding constraint. National evidence consistently shows that Aboriginal community-controlled services receive substantially less funding than is required to meet need, while mainstream health and non-government services continue to be resourced at levels that do not reflect outcomes or cultural effectiveness. Despite Aboriginal people experiencing more than double the burden of disease, funding remains several $1,000s per person below what is required for equity. And yet Aboriginal community-controlled organisations deliver some of the strongest preventative outcomes in the system, reducing avoidable hospitalisations, strengthening early intervention, and keeping families connected and well. Work that is often invisible within government reporting frameworks, shaped by deficit-based language and crisis-driven measures. For partners and funders, our data, our way provides confidence that investment in EDAS delivers meaningful, measurable change. Not because our communities are failing, but because Aboriginal-led, culturally responsive solutions work. The real question is not what EDAS can achieve, but what is possible when Aboriginal community-controlled organisations are genuinely and equitably resourced. When you invest in Eleanor Duncan Aboriginal Services, you invest in community-controlled excellence. You invest in culturally responsive care that strengthens families, supports elders, gives children the best possible start in life and builds systems that work for Aboriginal people. We invite you to walk with us, so together we deliver healthier lives, strong families, thriving children and connected communities. Our way on country.